Size. My audience is Maudie, Antonio, and Destiny. What I'm going to be talking about today is neonatal abstinence syndrome. Neonatal abstinence syndrome is where pregnant women expose their unborn infants to opioids. This causes the babies to be born already addicted to the drug their mother was doing while pregnant. My audience is interested because this is a topic that is not discussed a lot. They can relate to my topic because they may have had an experience including it. According to Toledo, neonatal abstinence syndrome has tripled over the years 2000 to 2009. Toledo 2016. The U.S. requires hospitals to report babies with these drug dependencies to social services, but most do not. Fetal assault should be recognized and handled better, such as charging women with aggravated assault all around the country, because this is a serious matter and is getting worse every day. I'm an expert in my speech regarding to NAS by doing research on the web over it. My 3 main points are stricter laws should be enforced on women that have this problem, the unborn deserve the same rights as children, and the cost for treating these babies with NAS is increasing. If pregnant women are irresponsible enough to take drugs while pregnant and it affects the baby, they should be fined every single time. This law should be enforced all over the country and the world and brought more awareness to. Charlotte Burke states 1391 amends Tennessee's fatal homicide law to allow these women to be prosecuted for the illegal use of narcotic while pregnant. If her child is born addicted to or harmed by the narcotic drug, and the addiction or harm is a result of her illegal use of a narcotic drug taken while pregnant. This bill allows women to be charged with aggravated assault, which carries a maximum penalty of 15 years in prison if they have a pregnancy complication after using illegal drugs. Burks 2016. Not every state enforces this law, and I feel that they need to do to the matter that they are harming an innocent human being. A law is not enough to stop every woman from doing drugs while pregnant, but it may help further fertilities. If people would obey laws, they would not be doing drugs at all. I feel that stricter laws, such as getting the child taken away, should be enforced to prevent the situation from getting any worse. Unborn babies deserve the same legal protection as children do. Some might think that these women are misguided or should seek help instead of being punished. In some cases, it might not be the mother's fault due to a poor opioid prescriber or whatever the matter is. It is also understandable if the mother actually cares about what is going to her body and what is going to be the effect towards her baby. Burke states the medical experts are opposed to criminalizing pregnancy outcomes resulting from drug use because it can discourage women who use drugs from seeking prenatal care, or even encourage them to abort an unwanted pregnancy rather than a risk prosecution. Burks 2016. A baby's life should be taken more seriously than what these women are doing to themselves and their unborn child. People can change their life around, but an unborn child does not deserve to be born with these conditions. Some symptoms of NAS are hypotonia, automatic instability, irritability, poor sucking reflexes, impaired weight gain, and not so commonly seizures, which are on this graph. These are the withdrawals of an opiate. These women that risk putting their own baby's life in danger so they could get a high deserve to be put in prison. Something that needs to be done about this quickly. There are too many babies that have unnecessary suffering from NAS. It is also getting expensive for doctors to treat these babies. According to Jones, the public health and medical costs are trying to reduce their costs by improving treatment options associated with the treatment of neonates exposed to opioids. 2009 was estimated at $70.6 million to $112.6 million in the U.S. Jones 2010. If it gets to that point where it gets too expensive, doctors can't treat these NAS babies. What these babies go through is unimaginable, especially for those of us who live a healthy life. It is urgent to have this problem reduced because if drugs can destroy an adult's body, imagine what it could do to babies. Neonatal abstinence syndrome is a problem worldwide that people need to take more action on. Something needs to be done to stop these women before any more babies suffer from NAS. What can we do to get through to these women so this problem can decrease? Something that we can bring awareness to NAS is advertising. Advertising real-life cases of symptoms of what these babies and also the mothers go through would be a great way of spreading awareness. Hopefully, from seeing what other NAS babies go through, it could get through to other women that are or might be pregnant with the same problems who think this could happen to them. All lives matter and should be taken into thought equally. And this is a baby that's suffering from NAS.